So in today's session, we will discuss about certain introductional part of quality control management. The first part of your book, first few pages of your textbook. Those who are joining late, please help them out with the topic name. So introduction to quality control management. Quality control management. So it aims to equip you with tools and knowledge to make one world-class quality control professional. Okay. So when it comes to quality control in hospitals, uh, majority of the policies are around patient care, safe, effective, and well-managed organization, medical professionals, education, and research programs. Okay. So these are the main areas where we focus in when it comes to quality control management. Okay. When quality control management in hospitals specifically or any healthcare settings, these are the areas where you have to focus. So once you uh, clear this course, okay, once you complete this course, in all these areas, you will gain exceptional knowledge regarding how to make a guideline, okay, how to make quality control guideline, how to instill policies and guidelines, okay, and how to make sure everyone is following these guidelines, okay. So quality in hospital is usually making sure that you are meeting the expectations of your patients first and foremost. Your first customer, your first priority in customer is your patients. Okay, you have to meet the expectations of your patients. Statutory legal bodies, you have to fulfill certain law enforcement rules and regulation. You should have certain licenses, certifications, registration. Okay, so certain department in the hospitals, one hospital license is not just enough. You have to you will require various other registrations and licenses, valid licenses and registration to run a hospital. So you are meeting the requirement of all legal bodies involved. Okay, your internal customers as well. Internal customers are your own staff. You have to meet the requirement of your own staff. Owners, shareholders, trust members. Okay? If there is a trust, the trust members, they will also have certain expectations in terms of profit, dividends, bonds that they hold in the hospital. So their expectations also have to be met. Then you have insurance providers, in which all insurance companies your hospital has been empaneled. Those insurance providers, they will also have certain areas where if you fulfill the requirement, you can become an empaneled hospital. So you have to make sure that those requirements are also always upheld. Okay. So that's how insurance providers' expectations should be met. Okay. You should make sure the processing of insurance is easy. You should have employees who look for and how to process any insurances, and there is no insurance fraud. Okay, you also filter out insurance fraudulent cases. Okay, so that there should be a trustworthiness of insurance providers in the hospital as well. Third party accreditation bodies like NAPH, JCI, ISO, okay, they all are accreditation bodies who accredit the hospital. So they will also have certain expectations if you hold their accreditation. Okay, if you are eligible for their accreditation, they do have certain quality expectations that you should be fulfilling as a hospital. You have to uphold that as well. Okay, so quality in hospital is meeting all these expectations from all these areas. So administrative focus of quality team. First is the volume. How many patient are you seeing on a daily basis? Okay, average patients visits, average OPD visits, total OPD visits that's happening. Okay, total number of beds that you have in your hospital, the volume of care that is given to the patients. Okay, you have the quality team has to focus on that, on these areas. The higher the volume, when the volume of care increases day by day, the patient visits increases day by day, the chance of errors happening also increases. So you have to keep an eye out for this. Where there is an increase in profitability, when there is an increase in patient availability and accessibility, okay, risk of medication errors, quality errors, healthcare errors also increase. So the team has to focus to make sure that these errors stay as minimum as possible. Okay, length of stay. If the length of stay of an average patient is more than 4 days or 5 days, okay, it leads to loss in the hospital. Okay, average length of stay, if it is more than 4 or 5 days, it leads to loss because majority of the initial tests are done in the first 2 days of admission. So the majority of the profitability, okay, is shared in those 2 days. And if the patient is staying over a week or so, repeated test cannot be done. It is unethical to do repeated test or unnecessary test for the sake of profitability. It is unethical. You cannot do that. So, when the bed is occupied by a patient who is staying for more than 1 week, you lose a chance, you lose the opportunity to give that bed to a new patient from whom you can collect more profitable charges on new services. That's how the length of stay matters. Okay. Then readmissions. Once the patient has been discharged, within few days the patient has been admitted back. Okay, once the patient has been discharged and within few days, if the patient is admitted back, that is what we call as readmission. So when readmissions take place, again, repeated test that recently you have done, few days back you have done, you can't do that test again. Readmissions usually it shows poor healthcare diagnosis or poor healthcare treatment choices. That reflects on the quality of healthcare. The quality of the healthcare and the patient's perception of quality of healthcare in your hospital falls down. Okay, so readmissions, that is kind of a negative, that has a negative impact on the quality of healthcare. Okay, cost or payer contracts or and reimbursements. So here the schemes that you have, the health schemes that are allowed in your hospital, okay, the health schemes or insurance schemes that are given in your hospitals. So if those are not respected, if these contracts, cost and payer contracts, that is like health schemes or insurance cases are not respected, and reimbursement is not given to the patient, or usually in some hospitals they take deposit money before surgery, and after surgery if there is any difference, immediately it has to be reimbursed to the patient. If this reimbursement does not take place immediately, that will also bring down the quality. Staffing and staff competency. So staffing and staff competency, uh, are you hiring good quality staff, well skilled, well trained staff, staffs who have completed their training and education, they have good experience in terms of years. Are you hiring these kind of staff? Okay, that comes under staffing and staff competency. How do you hire? What is the hiring process? What is the retainment? Okay, how often do people leave your institution? Okay, how are you able to retain your employees? These all matter. Okay, then coding and documentation compliance in the MRD department. Okay, in the medical records department, are you able to follow the ICD coding, whichever you have chosen, ICD 10, 11, 12, okay, whichever ICD coding system you have chose, are you able to comply with that? Okay, is there any issues of compliance? Doctors are not coding properly, or um, the personnel who is supposed to medical code the files, they are not coding it properly. What is the compliance rate in the medical coding area? Okay, it becomes an important factor in quality control of medical records, okay, and documentation. So compliance is tested. And electronic medical records, the use of electronic medical records, what software are you using? Is every clinical practitioner in the hospital complying with the requirements of electronic medical records? In some cases, senior staffs refrain from using electronic medical records. Okay, young people still are able to incorporate technology in their practice, but older staff are not able to. So, what is the compliance rate? Okay, is it equal or is it uniform throughout your practitioners? That matters. Okay, so these are the administrative focus of the quality tree. We have not come to the clinical side at all. This is just the administrative area where quality tree has to focus. Is it clear to all? So building blocks of quality, there are two main perspectives you should know. Okay, when you are working with the quality or you're working with the quality department, two main perspectives you should be aware of. Okay, when you work, when you make decision, when you take any control actions, okay, when you formulate any guidelines, how it affects the hospital's perspective, how it affects the patient's perspective. Okay, both will have slightly different perspective. First they will think of themselves. Okay, patient will think of their safety, hospital may think of their profitability, their goodwill. Okay, so whatever guidelines as a quality management or as a quality manager you make, whatever quality control actions you take, corrective actions, preventive actions you take, okay, how does it affect the perspective of the hospital, or how does it affect the perspective of the patient? Both are important. Okay, so quality from the hospital's perspective, from the hospital side, okay, it's six dimensional. There are six dimensions in this perspective. First is the safety of patients, staff, visitors. Patients will think about their own safety. Okay. their own health, their own safety. But hospital has to think about the patient's safety, their staff safety, employee safety, the people who visit them, students who are being trained under them. Okay, each and every working soul within the premises of the hospital, their safety is a concern of the hospital. That is one dimension. Okay, safety. What measures does the hospital has to take? In one shot, you are securing and making it a safe place to survive for everyone. Okay, that is important. And effectiveness. How effective are your decisions? As a quality manager, you will be making a lot of decisions, but the hospital will then question you. We gave you the freedom to take these many control actions, these many decisions, but it is not showing any result. Okay, so what answer you will have? Okay, so they are in the hospital's perspective, whatever actions you take at the end of the day, it should give the result. It should give positive result. Okay, that is effectiveness. Okay, the hospital can't sit and wait till you do your trial and errors. Okay, and lose all its resources, time, budget. Okay, the hospital will give you one shot to fire, and it should be spot on. Okay, in terms of quality of actions that you take, quality of decisions that you take, it should be effective. It should give result. Okay, it should meet the objectives. That is effectiveness. Patient centeredness. Nowadays, all hospitals are patient centered. So, this applies for the clinical team, not the administrative team, but more for the clinical part of the hospital. When there is a healthcare team working on a case, patient should be in the center of the decision making. You should ask the patient how comfortable they are. Are they willing for this treatment? What does the patient have? What opinions, what doubts the patient have? That has to be cleared because patient is the primary customer here. Okay, so the decision making should be around the patient. It's a patient centered decision making that is followed in the hospital. Earlier, it was not that. Few decades back, the doctor will decide and the patient has to comply. Now, the patient is also an active participant in in their own healthcare decisions. Okay, so that is patient centeredness. So this should be a focus. This should be a focus of clinical practitioners in the hospital. Timeliness. Here, the worries are what is the waiting time? How long the patient or the visitors have to wait? How long will it take to get the results? How long it will take to get the servicing done? Okay, that is timeliness, punctuality and timeliness. Don't keep patients, visitors, staff, your uh even your internal customers in terms of salaries. Don't keep them waiting for their salaries. Okay, it has to be come on in a timely manner. Then efficiency in work line, efficiency in staff quality, in physical structure. Okay, the way how the hospital is designed, it should be efficient for the movement of people, resources, articles, trolleys, food. Okay, so the hospital will look at the efficiency of the quality manager's decision. Okay, are they making efficient decision which the hospital can actually do? Okay, you may have a solution for a problem, but is that solution viable in this situation? Does the hospital have the budget to carry on your decisions? Okay, so that is efficiency. Then equity when it comes to shareholders. Okay, profitability is a big question. Okay, how much they are getting back in return in investing in this healthcare center or a hospital. Bonds, equity, trust money, these all are investments, and there should be positive returns of these investments. So profitability is also an area of hospital's perspective. Okay, These are the 6 dimensions that a quality control manager should be aware of. Next, coming to the quality from the patient's perspective. There are 5 main dimensions to it. Simple 5 main dimensions that everyone can understand. Okay. So, in this, from the patient's perspective, first dimension is don't kill me. Whatever action you take, whatever decision you take, the patient do not want to be dead until if it is a case of euthanasia in certain countries where it is allowed, until and unless that is a situation in all the other hospitals. Okay, the main intent of the patient is not to get killed. Do help me and don't hurt me. Okay, the patient is coming to the hospital to get aid, to get help on their health situation, not to be harmed more. When it comes to medical negligence on and cases that are filed in terms of medical negligence, here the patient was hurt. Okay, knowingly or unknowingly, the patient was hurt. Okay, don't make me feel helpless. So if you are not following a patient centered way of healthcare treatment, the patient will feel helpless, does not know what the doctors are talking about, does not know about their own condition, what will happen. Okay, the survival chance of treatment that they're going with. Okay, so that will make the patient feel helpless. Don't make the patient feel helpless. Make them part of your decision making. Clear their doubts. Make them be very comfortable. Be very friendly with them. In these all mannerisms, you can take off this dimension. Okay, don't keep me waiting. Respect your patient's time. Okay, their time, their efforts, their resources. Okay, don't keep them waiting. Time is also a resource. Don't waste resources, mine or anyone else's. So when in some hospitals they do routine testings on a daily basis, test or laboratory results that are not required at all, but they will keep on ordering it to make more profit. So that's a very bad way of treating the patient's resources. So you're wasting the patient's resources. Okay, so don't waste their resources. Don't push them for unnecessary admissions, unnecessary test. Okay, so these are the 5 dimensions from the patient's perspective. So that's about introduction to quality